Hi everybody, my name is Chuck Merrill. I'm the Chief Medical Officer here, and this is your virtual tour of our hospital. Normally in non-COVID years, we ask all the residents who get to come here for an interview, we take them on a tour of the hospital and sort of let you know who we are and where we're from and what our purpose is. Typically it's in October and November, and I ask you all where you're from, and you're going to be from all kinds of different places. I'm going to point out that today is another perfect day in Santa Maria. The weather's about 70 degrees. It may get up to 73 or 74. So wherever you're from, this is better. Now we are part of a Catholic mission, and I'm going to walk over here and show you the tree, the redwood tree that came from Redwood City. It's behind me over my left shoulder. And this indicates that we are a Franciscan hospital, living the mission every day of the Franciscan mission, which is, in a nutshell, to provide excellent health care for the patients in our community, especially the poor and the disenfranchised. As a not-for-profit hospital, this is what guides us every day, and it provides us with the mission with which we use to provide this excellent care for our patients. We're in our chapel, and this is a beautiful place. It's a time when we have services in here. Catholic Mass is done from time to time. We have mindfulness training. We've had string quartet concerts in here. And it's a great place to come to just have some solace and some peace of mind. Now, I know you all like to eat, because we all do, and here we are in our cafeteria. Now, you wouldn't think this is a big deal, but I find medical students and residents to love the cafeteria. And everybody here are food service workers and all. We're all on a first name basis. They'll make you custom food on the grill over there. There are vegetarian options. There's salad bar every day. Now, a lot of people like to have their lunch out here in the patio, and this is a beautiful place, and the weather, of course, is perfect here. It rains maybe 10 inches a year, which is not very much, but it's really nice to be outside and to be having your lunch with your colleagues. You are standing in our emergency department waiting room as we speak. We're about ready to go inside. You will do 2 rotations in the ER, one in your first year, one in your second year for the family medicine residents, and for the OB residents, that's an elective that they may wish to pursue. This is a full service ER seeing about 200 patients a day. We are a stroke receiving center, STEMI receiving center, trauma center, and really when you get to do your rotation here, you'll get as much experience as you could ever want. This, by the way, despite being a door to the emergency department, is the slowest door in the hospital. We're working on that. As you come over here, you will see that this ER is designed for having a pediatric emergency department right within the department itself. So we'll look at part of it, and you can see that the design is child-friendly. The point of this is that we keep our kids here and we keep the adults in separate areas, which is better for both groups of patients. And you, during your rotation in family medicine, will see at least 75 pediatric patients in your 2 years combined. So you'll have a good experience. Since family medicine is birth to death, you'll have a good experience here in the emergency department seeing pediatric patients. Let's go on and see what else we can find. Our hospital is designed, this is the med-surg area, with pods. So each pod has 4 patient rooms that you can see off to my left. This gives the patients privacy and quiet and peace, and allows one nurse to take care of the pods. It also takes away the centralized nursing station that you all are familiar with, which keeps our nurses out with the patients where they belong. It makes everyone happier, and it's a real patient satisfier as well. So we are in the waiting room, patient waiting room on the 4th floor, which is our med-surg area. And you'll see the beautiful view out to these windows. That our heliport is down here, our extended care centers across the way. If you look directly down, you'll see St. Francis and our ambulance entrance. And as you pan across the Santa Maria Valley, we're looking eastward at this time, you will see a series of hills. It's really a small mountain range, and from this moment all the way down about 30 miles south to Santa Ynez Valley is one of the best wine growing areas in the world. And this is where Pinot Noir grapes and Chardonnay grapes are grown. And for any of you that like wine tasting, this is a beautiful place to do it. Here's the view that we see from our 4th floor near the elevators. And you can see in the foreground a bird's eye view of the Family Medicine Center. Again, the tree from Redwood City. That's a symbol of our mission, and then the Tau, which is also a symbol of our mission in the background. Okay, this is the third floor, and here we call it Mother Baby, not trying to exclude the fathers by any means, but this is the name that it has taken on. We have our neonatal intensive care unit here, and a very busy obstetric service, delivering about 300 babies a month. So we're on the labor and delivery floor, and you'll see behind me, again, we have a couple of rooms. The rooms are very, very mother-friendly. They have jacuzzi tubs in the room. They're actually a real birthing center where ladies give birth to their babies actually in the room. There's, of course, a couch for dad. And so babies stay with mom right after delivery and dad until they're well enough to go or mature enough to go on the other side, which we also call Mother Baby. Okay, we have a chance to go visit an empty patient room on labor and delivery, so let's take a look. Here's a labor and delivery room. We've got a resuscitation area for the baby to my right. Laboring bed right here, full monitoring equipment. We have a neonatal resuscitation team that comes to every single delivery. And we think this is one of the safest places ever to have a baby. Bob Turbo, who's one of our neonatologists and very dedicated safety person, really believes that this hospital is the safest place he's ever been to deliver babies. And we're very proud of the work we're doing in the perinatal services department. In here is a jacuzzi tub. Behind me, you'll see the symbolic elephant is it okay with you if I ring the bell?
Absolutely.
Okay, I always get permission. Just want to make sure it's okay, but whenever a baby's delivered during the daytime, this happens. It's pretty nice. Cool, and a baby was just delivered, I'm told, so that's appropriate. Let's move on and take a look at the NICU. So you'll see babies of different ages in here. Some are what we call feeder growers. Some are on ventilators, but very well cared for. We have a reunion every year, and this year we had our 5th reunion, I believe, for babies that have been here. Now the residents get to rotate here and learn things about neonatal medicine they wouldn't know otherwise. All the residents tell me that when they visit other hospitals, and sadly none of you will get to do that this year, I don't think, but very rarely and almost never does the CMO take the time to take residents on a tour. So for here, it's something special that we do. I think it's important because I'm passionate about our hospital, and I want you to know that I do have a good relationship with the residents, and I think it's important that all the faculty treat residents in a non-hierarchical fashion. I'm no more special than the housekeepers or anybody else, and so we at Marian have that just culture attitude that we're fair and transparent, and we want you to be able to speak up when you need to speak up. So that's the culture we have. We're getting onto the 2nd floor here. We're going to walk, and this is our telemetry floor. Hey, Jacob. Hey. How's it going? So you'll do your medicine rotations up here. We are taking care of some patients with COVID-19, but we'll not go in those areas directly. You'll see a great variety of patients with all kinds of pathology, allowing you to be the best doctor you can be. This is the Todd Bailey Residency Conference Room. And as we go in, let's see, hopefully there's nothing going on in here right now. And here's the conference room that you'll do your Thursday didactics in, with lecturing and demonstrations and so on. And again, every year we give the Teacher of the Year Award in the name of Todd Bailey, and you can see there have been 5 recipients of this award so far. This is given to a non-faculty member voted by the residents for every respective year for the person that has done the best teaching. So normally this is where our tour ends. And I deliver half of you to the cafeteria, which is going to be off to my left, for a nice lunch, and the other half get to go do interviews with the faculty members. Our family medicine residents we've graduated 5 classes now, and all of them have passed their boards on the first try, so that's a big deal. And we'll see which of you get to be with us next year, and we're really looking forward to helping you become the best doctor you can be too. Thanks for coming on the tour.